Keep the music.
Yeah.
Hey guys, it's anthropologist Brittany, and I'm in the only place where I actually get privacy, which is a bathroom. Anyways, so I wanted to talk today about my research on YouTube with weight loss surgery patients and their use of YouTube for connections, and how that deals mostly with their urges to eat food and their relationship towards food and the symbolism towards food. I'm doing it for an anthropology of food class, and so it is going to be around food, but I also want to incorporate YouTube on how people stay more on track with that and the symbolism behind the food with that, because we all know that food is more than just dietary. It also has a lot of symbolism and a lot of power. I have two participants right now. One is a post-op, which means she's had her surgery for more than a year, and one is a pre-op, which means she's getting ready to go through the surgery. So I'm going to be looking at their food diaries, their thoughts about how it changed their life, how it will change their life, and how they use YouTube to either replace food or change the symbolism of food and the interconnectedness with groups to help change that symbolism. Some of the questions that I'm going to be asking differ between the participants because there's a pre-op and a post-op, and I'm also doing a veteran category, which I'm still trying to get a participant for that. Some of the questions that I'm going to be asking is, how do they use YouTube for ideas on food? For example, with Melting Mama Melted, she promotes some food. She does some critiques on protein foods, and kind of how YouTube helps to create that network. How does the relationship between food and YouTube help the person succeed or not succeed? I kind of want to look at the post-op and pre-op people and see their relationship towards food and social relationships before this, and their food and social relationships after this, as compared to YouTube. Does YouTube, with the social network and the use of food, help people to become stronger? Did they have more social networks than they did before they had this surgery? Was food eaten in private before they had the surgery? But now, since they're on YouTube and they're documenting, it's more of a social network so that people can have more social networks around food, and so food now is symbolically social instead of non-social. What do weight loss surgery patients feel if they decide to close down an account or open an account? And what was the relationship before and after they opened or closed the account? Do they go to different networks like group counseling or whatnot? What would they do if there was no YouTube? Would they revert back to their behaviors? Is there more success rate or not a success rate? And without regard to YouTube, what are some of the relationships towards foods before and after the surgery? What are the changes in food? What are the changes in lifestyle, etc.? So it's kind of raw outline of what I'm doing. It's definitely in the first rough draft stages. I'm still creating questions. If you guys have any questions that I can pose, that would help a lot. And I hope to see you during this week as I fine-tune it and I get more questions and I kind of organize it a little bit better. But I just wanted to give you an update, and so I hope that you guys will be participating. See ya.
Friends dance, higher their hands for the music. Keep it bubbling for fans. Tight, they can't